Hi everybody, thank you for tuning into Ortho Boston TV. I'm Dr. Tim Hartshorn, and today we're going to teach you how to properly stretch your calf muscle. So tight calves are something I see in clinic quite a bit, and patients have difficulty really stretching out their calves. It's something that can be hard to do unless you do it correctly. And there's one thing that's very important to understand when you are trying to stretch out a tight calf muscle. To exemplify what I'm talking about, I'm going to use my favorite anatomy program. Hop on in, I'll show you. Before we actually get into the stretching of the calf, it's important to understand the anatomy of the calf and what we're actually stretching and why. So if we zoom in here on our anatomic model, the first muscle we run into here is the gastrocnemius. So made up of two heads, and it's the calf muscle. It's the one we see, the one that's easy to see, the one that people know about. The important thing about the calf, what people don't know about it, is that it crosses the knee joint. So see, there's the calf muscle, and we can see this is the knee joint, and the muscle actually passes by the knee joint and attaches to the femur on the back part of the femur. So when your knee is straight, the calf is tight, the calf muscle is tight. But if your knee is bent, then the calf muscle is loose. It's not on stretch. If we remove the calf, so let's hide that one, lateral head, hide that one. So underneath the calf is another big muscle, the soleus. People don't know about this one, but it's also very important for plantar flexing the foot. Important about the soleus is that it does not cross the back of the knee joint. It stops short of the knee joint, and so it doesn't matter if your knee's bent or not. While you're stretching the soleus, it's still going to get the same stretch because it doesn't cross the joint. And then here is our little buddy, the plantaris. It's a vestigial muscle, meaning we don't really use it anymore, but clinically it's relevant because it'll pop occasionally and people think they tore their calf or tore their Achilles, but really it was just this tendon rupturing. It's a little tendon. You can see it runs along all the way down the back of the leg to the ankle, and functionally it's not relevant, but clinically it can be relevant because patients can rupture that. Okay, so now that you know that information, let's talk about the stretch. Very simple stretch. You find a wall, you put your hands on the wall, and you actually put your affected leg back this way. We're going to start with my leg straight. So with my leg straight, the gastrocnemius is tight. It's crossing the back of the knee joint. Right here it's loose, but with my leg straight it's tight. So heel always has to be on the ground. Toes can be pointed in a little bit. That helps hit the muscle a little better. And with my hands on the wall, my knee straight and my heel on the ground, I slowly move my hips forward like this. If my heel comes off the ground, it means I'm leaning forward too much. And so you want to go as far until your heel is about to lift off the ground and you feel a nice stretch. Again, you're pushing through the back of your heel. Now, the only difference to get the soleus muscle is you bend your knee. You don't really change anything else. You just bend the knee, and again, hold the wall, lean forward, pressing through the heel, keeping the heel on the ground. And since my knee is bent, the gastrocnemius is loose, so I'm only stretching the soleus here. So by doing those two stretches, you're stretching the gastrocnemius, you're stretching the soleus, and if you're doing that multiple times a day, it's easy to do pretty much wherever you are. You can improve your flexibility in your calf quite rapidly. So thank you for watching today. I appreciate your time. You can check out our website, www.ortho.boston, for additional information, and we look forward to seeing you on the next video.